Good afternoon, my name is Rob. Welcome to this new YouTube channel. Just want to take a minute to welcome you and say thanks for checking it out. This is an opportunity or an attempt for me to encourage folks coming back from brain surgery to get back on their bikes, mountain bikes, gravel bikes, whatever they ride. I just want to be an encouragement to somebody. So my voice is kind of gone right now after the surgery. I hope to get stronger as I go, but I'll kind of give you a little bit of background of myself and kind of what brought me to this moment. So I've been biking since I was a kid, like most of us. I kind of stopped biking quite a bit when I was in college, high school. Then about 1998, 99, I got back into it a little bit. When we lived in Emporia, Kansas, we then moved to Lawrence, Kansas, where we currently reside. And I kind of got back into it a little bit, but then with kids and everything going on, I kind of got out of it. So fast forward to 2011, on Valentine's Day of all days, which is ironic, I had a heart attack, and 4 days later I had 5 bypass open heart surgery. So coming off of that surgery several months later, I needed something to lose weight, build my heart muscle, and I'm not a runner. I'm always been a pretty big guy, so running doesn't do well for my knees. So I decided to get back in the cycling and particularly mountain biking. I bought a Raleigh mountain bike at a flea market in Topeka for $60, and it got me back into the sport. Several years later, my family all pitched in together and got me a Giant Talon, which is what I currently ride, mountain bike. I also have a Poseidon Ambition X gravel bike that I just bought this last summer. So here I am now on Tuesday, January 28th. I suffered a small stroke. I was at work. My wife has already lectured me about this, so don't send me emails commenting about this because I've already gotten in trouble for it. That Tuesday morning, I was brushing my teeth, and water was literally squirting outside of my mouth, hitting the mirror. Most people should have gone to the hospital then. Well, I did not go. I went to work. I work over in Topeka. So I drove to work. 1 o'clock in the afternoon, I had a meeting, and several people I met with told me I needed to go to the emergency room. So I should have gone to the emergency room there in Topeka. I'm director of transportation where I work, so it would have been very easy for me to get a ride from one of our bus drivers or our van drivers to the emergency room in Topeka. But there again, I didn't do that. I thought it'd be easier for my wife and my family if I went to the emergency room in Lawrence. So I drove back to Lawrence. My speech was slurred a bit. They said I had a droopy face. The left side of my face was drooping a bit. And my mouth was kind of numb on the left side. So anyways, I get back to Lawrence, and then my wife takes me to the emergency room here in Lawrence. We got there about 4:15. They took me into the CT scan. They immediately found that I had a brain bleed, and they automatically, 2.5 hours later, I was over at KU Med in Kansas City, Kansas, where the surgeons are, where they could take care of me better. So that was on Tuesday the 28th. On Thursday the 30th, they did brain surgery. I got out of surgery about 7 o'clock that night. Big scar on my right side of my head. The doctor joked with me because normally I shave my head, so the surgeon joked with me, said that at least he'd have to shave my head for the surgery, which was because I'm normally bald. But as you can see by my beard and my hair, I haven't shaved for over 3 weeks, close to 4 weeks now. So probably when I'm doing this video, I'm probably gonna go shave my beard because it's kind of irritating to deal with. So anyways, I went through surgery on the 30th. On Tuesday, February 4th, just 4 days later, 5 days later, they transferred me from KU Med Center in Kansas City back to Lawrence, to the Lawrence Hospital, where I went to Lawrence Rehab. I was there for a week. I transferred home last Tuesday, the 11th. While I was at rehab, I did physical therapy, occupational therapy, did some speech therapy. I'm still having some struggles with speaking. They put a tube down my mouth, but my muscles are weak on my left side of my face. I still have some numbness in my left hand. I can't use my left hand completely, but my left leg is fine. I can walk fine. I can move my toes. Everything's going well in that regard. Just really the only bad aspect right now is the mouth and and my left hand. Doctor said that could come back. Doctor said also it might not come back. So we'll cross that bridge when we come to it. So we'll just see what happens there. But every day is a better day. My goal was to stack good days on top of each other, and what I'm about 11, 12 days in the good days. Every day is a better day. I sleep better at night. I still have some soreness in my head, basically from the incisions they made and from the surgery. I'm down to taking Tylenol for the most part, a few times a day for that pain. It's more of a soreness, not really a pain. But that's kind of where I kind of sit right now. And like I said, I'm going to do these videos periodically. I'm going to kind of keep everybody updated on my progress because I just want to be an encouragement. My goal is to get back to where I'm riding my mountain bike, riding my gravel bike. There's a couple gravel events that I want to ride this year. So my goal is to get back for those. My first goal is to get back riding my bike before Memorial Day because we go to the Bentonville Bike Festival every year and down in Arkansas. And I'd like to be able to ride my bike down there. Maybe not the mountain bike trails right off the bat, but just to be able to ride down there with my family. I always look forward to it. And then the next big thing would be the Pony Express gravel grinder up in Marysville, Missouri, the first week of September. That's really my goal, to get back to where I can ride and not have any issues, not have any problems, be able to do a 35, 38 mile organized gravel ride. So I did it last year with a friend, Rich, and we had a great time. Hoping to be back this year to do it again. So anyways, as my voice comes back, hopefully it'll be a little bit louder. You'll be able to hear me. This is my first time ever doing anything like this. So if I don't look straight in the camera, I apologize. I'm not an actor. I'm just a normal guy going through some crappy stuff. So anyways, thanks for joining me today, and I'll keep these short. Tomorrow I have a doctor's appointment where we find out the results of my test, what they did during surgery. I'm sorry I didn't say it earlier. They pulled a tumor out of the right side of my brain, and they had it tested, and we'll get the results, and we'll talk with the doctor tomorrow. I will probably have to go through at least 6 weeks of radiation treatment with this once we come out of this starting in March. But I will have an hour of physical therapy, hour of occupational therapy, hour of speech therapy every week for several weeks, actually for the next several months, actually. And then radiation on top of that, possibly some sort of chemotherapy pill, because we're pretty sure, just from talking to the surgeon, we're pretty sure that this is some sort of cancer that we'll find out tomorrow. Good thing is, after my last MRI, they couldn't find anything else in my body, so I have no more masses that are disturbing to anything. So which is encouraging. But considering where I've been through and what the way I kind of handled it at the beginning, I really feel fortunate to even be here to make this video. So again, thanks. I'll keep everybody up to date, and I appreciate you guys watching. And sorry if I'm so boring. Hopefully it'll get better as we go. All right, thank you. We'll talk to you soon. Bye.